Cloud. There we go. And we are all set. I am excited because I'm going to get to interview Michelle today with me. Michelle is a nurse with the company Valasta, who I had done a previous interview with the founder and the chemist, Sam, earlier. And that led to a bunch of questions. And so Michelle so gracefully and wonderfully, generously said, I will come on and do an interview and kind of talk about some of those basic questions that people need answered. So Michelle, why don't you just go ahead and tell us a little bit about your background, how you just kind of even got into the field of healthcare, and then how you got involved with the company, and then we'll start talking about the products and stuff after that.
Okay. Sure. So I've been a nurse for a little bit over 30 years. A lot of it's ER and ICU. And I had about 6 or 7 years in the pharmaceutical educator arena, educating on biologics for autoimmune conditions. And the whole pharma world was quite eye-opening for me. I just didn't feel like I fit. I felt more at home with the holistic approaches. And so my stepdad and Sam know each other. And so I did become aware of Velasta and astaxanthin. I knew about astaxanthin, was taking another brand, not getting the results I was looking for with adrenal fatigue. And so I made a phone call to them, and they let me know that they were looking for a nurse, or they would soon, because they were growing so fast. And so that's how it happened for me. And I've been here almost 5 years.
That is so exciting. And I love your story of going into a field and then realizing this isn't really jiving with how I feel we should be helping people. Because I should have also mentioned at the beginning of our interview, I also have a naturopathic doctor, Dr. Angela Rahm, on with us as well, who will be chiming in and kind of asking questions as well. But I think that's where we all have in common is we enjoyed science and the aspect of helping people, and then realized once we got into our profession, there were some missing components, right? There were some gaps. And so we've each found different ways to kind of fill those gaps. And I think it's neat how God brought us all together. And so
Mhm.
and then a lot of people obviously that are going to be watching this are of that same mindset. So I'm sure there's viewers that are watching this now just shaking their heads and saying, yes, that's exactly right.
Yeah.
So they're really excited about the information you're going to bring to us. So you had mentioned astaxanthin. So let's talk about that, and maybe even some of the products that you started taking as well, because that's really where a lot of the questions are going to be revolved
Mhm.
around. Is this astaxanthin? What is it? Why is it working so well for so many different
Right.
people?
Right. It is hard to believe that one product, I get it, that one product can actually do so much. But when you realize that the root cause of all our conditions is really an overabundance of free radicals that leads to inflammation. With autoimmune, that inflammation can just attack any area of the body, as you know. And so, what Velasta does is it's a free radical scavenger. It actually goes to the body, will find those free radicals, which are damaged cells that are missing an electron, and it will donate an electron. And now it's no longer unstable, it's a stable molecule again. If they were to be left unstable, they kind of join together, and that's how cancer starts, is that all these unstable molecules kind of start, they're all searching, kind of like a bad dating website, they're all searching for something. And then they kind of start connecting together, and that's how cancer forms. So think about the root cause of issues. It's really inflammation, and as we age, the natural intrinsic glutathione that God gave us starts to decline with age. And that's just how aging happens, the eyes, dementia, things like that. So if you can take care of the root cause, if you can take something that's going to scavenge free radicals on a daily basis, we're all living on the same planet, and we all have inflammation and free radicals. Even if we have the most healthiest lifestyle and exercise, even intense exercise and stress can cause free radicals. So what my clients have is more energy, better sleep. I mean, that deep REM sleep is so important. Better valve movements and clear thinking. And then they're realizing it's all tied together to inflammation. And with our brand, they get those results generally within 2 to 8 weeks, which is pretty amazing because it's generally that first bottle. My clients are saying something is different. I'm feeling something work. This is amazing. And of course, it takes a little bit longer for chronic issues, like 3 to 4 months, to see the full effect of Velasta. So we do let people know, keep going with it. So with our brand, it is absorbed in the stomach. I get the question a lot. There are a lot of other astaxanthin brands I can get this for $19.95 at Walmart. What's the difference? The difference is there's a category of synthetic astaxanthin. Astaxanthin can be used in the food industry. And then there's the natural product of astaxanthin. There's quite a few steps that our company takes to make sure that it's viable for you once you get it. We're adding a high quality Moroccan olive oil and a glucosidic bond so that it is absorbable in that small intestine. And then we have you take it with food, because the longer it can stay in your small intestine, the more time you're giving that absorption process to happen. Um,
I'm
and
glad you
I,
mentioned that. That that is, I mean, obviously a question that's going to come up a lot. And that's not something that we got into when we interviewed Sam. So I'm glad you mentioned that. And just kind of like where it's absorbed and all of that kind of stuff. There's also, I noticed on your website, because I was just, and Sam and I talked about this, I had just started it based on a recommendation, and that person was doing the chocolate bars and I just did the chocolate bars. But now I've seen that there are other options where you can fill capsules. There's a topical thing. So how does somebody know kind of like where to start if they, have seen all of the
that's a
science and the
great
magic behind
question.
this? Yeah.
Yeah, that is a great question. So we do have it, astaxanthin in chocolate squares. It's real Ghirardelli. So I do let people know it's real sugar and carbs. So if someone has cancer or they have diabetes, it may not be the best product choice for them. Or if it's weight based as well. So somebody who weighs, 100 pounds is going to take a lot less. Their product will last them longer through the month than someone who weighs 200 pounds. And what my role is to help people get on the right amount for their body weight, since it is absorbed by the body tissues. It's based on your weight and your health condition. So the chocolate squares are amazing, but it is real sugar and carbs. I think most people are taking the olive oil version pump bottle, and you can pump it onto a spoonful of food like applesauce, peanut butter, yogurt, oatmeal, and take it that way, and then follow it with more food. Or you can fill up the empty capsules that we send for free. Everyone will get a bag of capsules. We are soon to launch pre-filled capsules. Well, I think we're like 2 weeks away from that. So that is very exciting. Even for those who still want to fill their capsules, but maybe they're traveling, can order the pre-filled capsules. Yep. So we were
That
excited about that.
that will be exciting, because I have not done the capsules yet, but that's a very good point about, there may be times where you don't need to be ingesting that much sugar as well. And so one thing that I thought was super helpful is I was able to email in, here's my health conditions, my weight, all this kind of stuff. And then they tailored it for me. Like, this is what you can be taking. Is that your best recommendation for somebody that's getting started, is just send in an email?
That is the fastest way to communicate, with the amount of calls coming in and phone tag that goes on. I think the emailing is the best. And what we do is we email back specific research according to your condition, from NIH or PubMed, or any newsletters we've done in the past on that condition, so you can understand more of the oxidative stress behind that condition. And then we do email your serving amount with a schedule for you to follow, because we're going to gradually build up. This is a strong antioxidant. This is another really great topic to cover, is that this is a strong antioxidant. It is the equivalent, food equivalent of you suddenly eating 1,000 carrots, 1,000 tomatoes, 2.5 salmon, and 1,200 cups of blueberries worth of antioxidants a day. So we want to go slow. We'll gradually build somebody up. If they're super young or they're a little bit on the older end, we'll be even more slower with the schedule. So the age is a factor too that we factor in. Um, it is a very strong antioxidant. So we do let people know, that you can't just take all the pumps at once. You could, it's not going to be detrimental. But what we like to do is let the bowels kind of gradually get used to this antioxidant, because one of the first things that's going to happen is that inflammation and mucus is going to be leaving your body through your colon. So some people can have loose stools in the beginning. It is a phase. It's a clean out phase is what I like to call it. And it's highly welcomed for most people that deal with constipation and hemorrhoids and things like that. But if someone's got an autoimmune condition like ulcerative colitis, we might even be even slower on that, gradually building that up for that person, because we know they're already having some diarrhea, but the diarrhea is from the inflammation. That's what's causing it. And so we let them know we're going to go a little bit slower. Increase your water intake, because that will most definitely help you get past that clean out phase, and then it levels off. And then most people are regular after that, which is amazing, a welcome benefit. But what I find from my ER days, and it's still true to this day, is that people are not drinking half their body weight in ounces of water. So they're starting on blessed, they're already dehydrated. And whenever you're not giving your body the fluids that it needs, you just kind of get used to it and your body stops. I hear, well, I never get thirsty. Well, you can turn off those body cues when you ignore it long enough. You're not going to feel thirsty. But if you start to give your body that water and really make a conscious effort to keep water next to you and don't add Crystal Light or anything to it, then your body will want that water again. You can turn that cue back on. And
Yeah.
and so that's one of my main platforms, is really educating on water, and the tea and the coffee and the Crystal Light. All of that actually can pull water from your cells. It doesn't actually give you water into your cells.
Yeah.
And
Don't
so,
add other toxins to your water. That's probably a good,
right,
a good, yeah, a good reference there. Now, Dr. Rahm, who's still in practice, will probably definitely sees more patients than you and I do anymore. But Dr. Rahm, do you have any specific questions, maybe about how your patients would get started, or anything that you want to come in before we go to the next topic?
Well, I've had how I first found out about this was about a year and a half ago, and I had a patient with lymphoma, and he bought me a bottle because this was what he said he knows cured his cancer. And I was just like, all right, this is pretty phenomenal. And I really like the fact that you do go kind of the low and slow, because it is, people are on medications, people are communicating with their doctors, and there's such a fear base in the medical system that if people are doing something like this, doctors kind of get red flagged and they start kind of just making the patient feel like they're doing something wrong because
mhm,
they're kind of in this, I don't know what to do. And I know you're probably going to address more of this as the conversation goes, but to hang in there, to keep going, right? But yeah, I mean, I'm hearing phenomenal things. Personally taking it, we're already seeing, kind of back on it again, just because it came back up with Dana, bringing this to my attention again. I had kind of let it go, and I am very excited about just what we're seeing in, less than 2 weeks. So I'm excited to hear more and come up with some questions.
Yeah, I should have mentioned this too at the beginning, because Michelle, you and I have talked about this, but the way that I was introduced to this was when I had a melanoma diagnosis. I had reached out to somebody that I remembered had mentioned melanoma on Facebook and just said, "What did you do?" And she said, "I met this angel of a woman, Michelle, who told me about this," and credits, her complete cure from it to this product. And that's how I got connected with you and then with Sam. And so, of course, I was like, just like Dr. Rahm was saying, like, if somebody's like, this did it, I'm like, okay, tell me more. I need to know about that. So now, so we started talking about when you get started on it. And I did that. I ordered it and then I sent an email in, and, we just figured out how I should get started. Now, other than that initial maybe loose stools, watching the water, are people going to notice any other detoxy type symptoms, or what are there ways they know like, oh, this is working, or, you know, what else will they notice on this?
That's a good question. Yeah, mainly energy. That's one of the first things. I'm out working in the garden. I don't have to take a nap anymore. And it's not a B12 energy boost type thing. What you're doing is removing the inflammation in the mitochondria, which are your powerhouse cells. So that gives you sustained energy. I was able to go up the steps without, being winded, or I did better. I'm doing better at my workout, with CrossFit or biking or whatever. That's what I hear first. And then I think second is deep sleep. I'm not waking up 2 or 3 in the morning anymore. I'm sleeping well. And we all know how important that sleep is. It is, and I tell my clients, I said, sometimes it's just a negative feedback loop. You're not sleeping well, you're insulin resistant, so you're gaining weight, and the doctor wants to put you on medicine for diabetes. And now your pancreas is not working because of the medications, and now you need insulin. So I call Velasta the cogwheel stopper. We're going to stop it right here so that we don't have to go forward with the side effects of the pharmaceuticals. As you know, a lot of our physicians are not in tune to anything holistic, and it is hard to believe. I can't even imagine being a cancer client and being so confused with all the products that are out there. It's mind blowing. But what I like to tell people that this is a very powerful tool to have in your cart. Very, very powerful, because Sam has a patent for this brand, based on the formula that we're using. He's a physicist. He knows how to make this product absorbable. He's got the background, and he's in remission himself, and that's how the company started. So using that glucosidic bond is the key to our formula. So the cancer cell loves glucose. We know that. So if we can add that glucosidic bond at the end, we are not adding table sugar. I get that question a lot. It is a bond that's bonded to the astaxanthin itself. So the cancer cell will grab that glucose and take in astaxanthin unknowingly. And once that happens, astaxanthin is donating a hydrogen ion, which changes it to an alkalinic cell very quickly. So cancer loves acid. It wants to be in an acidic environment. It grows, it thrives, it loves it. Well, we're putting a cog in that cogwheel, right? No, now you're going to be an alkalinic cell. You're no longer going to thrive or grow. And that's how it works on the cancer cell. And even, Velasta crosses the blood-brain barrier and the retinal barriers. So we've got people with glaucoma and brain tumors getting positive results as well. It's really a remarkable product. That's how it can work from everything from A to Z, because everything from A to Z really starts with oxidative stress and inflammation. And when we get that through to our clients, then they really get it. And there's nothing synthetic about our product. And it can be very, very confusing, because someone can Google astaxanthin and what they'll read is caution. Do not use it if you have diabetes. Caution. And I'm bringing this up because I get this question a lot, and I understand it. Don't use it if you're on blood thinners. And the reason is because Velasta is going to correct the insulin resistance. Now your insulin is going to work properly to move sugar out of the bloodstream. You're going to no longer need that medicine at some point. That's why they're saying caution. So we ask them, keep a log of your blood sugar so that you can see it trending down. It's not just gonna drop suddenly. It is more of a gradual improvement, but you'll be aware, and your doctor will be aware, and then your doctor can make those adjustments with you. And even with blood thinners as well, keep those doctor's appointments if you're getting your INR checked regularly. Some of our blood thinners now are so mild, they're not getting anything checked, and that's fine. But what Velasta will do is it will even normalize abnormal clotting factors. If someone's got some abnormal process going on and they're producing excessive platelets, it will normalize that. It takes time, probably around 4 to 5 months for most people. So it's not just going to suddenly improve and now you need to come off medicine. It's going to be such a slow, gradual. But if you're keeping up with your doctor's appointments, you're going to notice those improvements. They're going to be doing that blood work.
Right. And just like you mentioned, people with, if you have a condition where you can track things, you're tracking your blood sugar, you're tracking your blood pressure, things like that. Like, I think what we should be doing in all of healthcare is really empowering people to take control of their own health and not be dependent on fixing like this end of, this whole chain of issues. When we look at like the biochemistry of how the body works, foundationally, it really is all of the stuff that we're talking about. So we would hope when we start, repairing some of those root causes that the body would function better, and I'm glad you mentioned that because it should not be a caution. It should be a hooray, a celebration. You may not need these things, your body may correct its dysfunction along the
Yeah.
way. So that's very important for
But
people to
yeah,
understand.
exactly. The problem is that when you Google it, it's not going to explain it like that.
Not at all.
Correct. No. And when I first started here, there were nothing but positive things about astaxanthin. Now there isn't so much. It is quite tailored towards the industry of pharma, as you know. And I think a majority of people like your followers and a majority of people in general, they're just done. They're just done with the side effects. They're just done. They've seen their family go through chemo, radiation, and they got better temporarily, and then it just nosedived because you're adding all that oxidative stress. And I think that there's just a huge amount of people that are searching for the natural solutions and doing it through a natural food supplement like Vilasta with no side effects. Of course, your stools will be red because astaxanthin's red in nature. Let me say that. We do tell people that. It's more of a reddish orange tinge. It's not a blood color by any means, but we want to see that in your stools because we know you have some spillover, right? The body's using this, just segued me right into where I wanted to talk about, is the absorption of Vilasta. Am I taking enough? You were going to know it when your stools are mostly brown, but red and orange tinge. That's when you know you're getting good absorption and you're right where we want you. We want to see some spillover of that color. If your stools are brown every day, then you're not taking enough. If your stools are so super bright red, like strawberry, then you're probably, and you've been on it for a while, like 4, 5, 6 months, your body tissues are probably fully saturated and we can cut back a little bit. So the stools do tell us a lot. The stool color does tell us a lot. Now, we do have some people that just don't have the enzymes to break it down at first. Vilasta helps you to even develop the enzymes to break it down, but you have to keep going. And, usually after week 2, then they're right where we want them to be. So you can understand why I would probably get a lot of these emails, like, because people want to know my stool is this color or that color. I said, don't concentrate so much on the color of your stool every single day, because the amount of oxidative stress you take in is going to be different every day. If you eat poorly on one weekend, your stools may be more brown because your body used up all that astaxanthin. It needed it. You had more free radicals. Versus you have a weekend where you're eating super healthy, your stools may be more red or orange because your body didn't need that much of the astaxanthin. It will take what it needs and excrete what it doesn't.
That's fascinating. I'm glad you mentioned that because yeah, y'all do mention that, and that is true. It will change the color of your stools. I can attest to that. Dr. Rahm, did you want to chime in? Do you have a question that you want to ask?
Well, yes, and I love the fact that you can regulate something by your own body. I mean, to think about that just based on your stool. We talk about stool all the time. It's the main topic of conversation. People get a little embarrassed. I'm like, oh, that's like, that's table talk, Um, is there any medication? I think well, I know the answer, but just to have you kind of elaborate just a little bit on people are on medications. People are on 3, 4, 5, 20 medications at a time. A lot of people are on statins. Has there been any issues with medications with contraindications that you know of?
That's a great question. I do get that one a lot. So, since Vilasta is a food supplement and it's not metabolized through the liver or the kidneys, there are no contraindications with medications other than we ask you to check those blood sugars, because if you're taking astaxanthin, your blood sugars are improving, but you're continuing to take your metformin in high doses or your insulin, especially insulin, you need to watch that because you're going to be ready to start backing off on that. So keep a log. Other than that, there are no contraindications with this. That's what's so amazing about my job. I mean, right? I've got a job where there's no contraindications. This is a natural food supplement. Um, it's a strong antioxidant. It's going to bring down inflammation, and you're going to feel better generally by the first bottle. That's pretty amazing.
That is pretty amazing. Yeah. And there's not many that can say that. So is there a time, Michelle, where someone is done? Like they need to stop taking it? Do people need to take a break? Does the effectiveness wear off? I mean, I'm sure there's other questions of like, how
Great.
do I know how long I keep doing this? What's your advice for those people?
Great question. So I do get that question a lot. So if a person were to have their symptoms resolve or they go into remission, they will come down to a prevention amount based on their weight. Generates quite a bit less. That's just so we can keep up with keep that oxidative stress under control. You can get your C-reactive protein levels checked, which is a test for systemic inflammation. But as you know, somebody can have cancer and have normal C-reactive protein, right? So we just ask them to go down to a prevention amount. And I think what that affords our client as well as peace of mind. Like, I don't want to deal with this again. I want to be in remission. I want to stay that way. And, something happened in their body, whether it's abnormal hormones and inflammation or both, that caused the cancer in the first place. So they can come down to a more proactive amount at that point when symptoms resolve or when or if they go into remission. Then they can reduce to a prevention amount. Your body does not get tolerant of this. You don't have to take a break. I get that question a lot because it's not going through your liver or your kidneys where you need to give your liver a little break. You don't. You want to take it every day because if you stop taking it or you take it irregularly, it leaves your body tissues. So that saturation level is waning up and down, and we want to keep it at a level saturation. So we just ask you to take it every day and take it with food. Generally, we'll split up the dose at first, take part of it at breakfast, part of it at lunch. And after week 3, they can take it all at once for convenience, either, just with breakfast and then go about their day. And most people, to tell you the truth, I get that question a lot. They're usually new clients because once they get on it, this is how the tone changes. Are you guys going to run out? Because I want to stay on this. Like, please tell me that this company is going to be around. I don't want to stop taking it. It's amazing. I'm taking it on vacation. I left it at home on vacation and my gastric acid level was high. I didn't have the energy I needed. And, I want to they want to take it, so you can take it for the rest of your life. I mean, this is a natural food supplement.
Yeah. Yeah. I had a little mini panic mode because I went through my last bag and then had to order some more and had to wait a couple of days. And I was like, I'm not doing that again. I'm not running out. So, learned my lesson there. So we've talked about the little chocolate squares. We talked about the pump and how the capsules are coming. And I think because my cancer was a skin cancer, Sam had mentioned the topical, which I just ordered and got in. So do you want to talk about that? Like what the topical is used
Sure.
for?
Sure, yeah. So that we have Velasta in a salve with DMSO. So DMSO is a chemical that will deliver the astaxanthin through the skin layers deeper. And typically anybody who has a skin rash, they have psoriasis, cancers, warts, moles, you can put a little thin layer. You want to start with clean skin first and then put a thin layer of the salve externally. Cover it because it is red as well, and it will stain sheets and pillows. Cover it and then shower it off in the morning. Most people use it at night, and we get remarkable results, especially with rashes and skin cancers and things like that. And another additional thing with astaxanthin I forgot to mention is that astaxanthin is the covering over a microalgae, Hematococcus, pluvialis. That word I have a hard time saying, even after 5 years. Pluvialis. And why that covering happens in the first place is that this algae is exposed to sunlight and UV radiation. And so in a response for protection, it forms astaxanthin to protect it. It does the same thing to you. So when you're out in the sun, you're going to get that extra UV radiation. And people tell me I am not burning. I tan easier now. I'm not burning when I go out in the sun. It's providing the same protection for you. So not only are you in prevention mode, taking it with oxidative stress, but the skin is being protected, and then the salve also will deliver it deeper into that skin layer. Now the salve you don't need to take indefinitely, just until the skin cancer is gone, the rash is gone, you know, as a preventative.
That's fascinating. And I know when we talked to Sam, he did get more into the context of the algae and kind of how it was created and discovered and all of that kind of stuff. So we do have a video on that. I just think it's really cool how we can learn from like God's creation of like, oh, this is something that we can utilize. One thing that Sam did mention, and I thought this was very fascinating, is how then the pharmaceutical industry, because they cannot patent typically something naturally, Sam has found a way to patent this, but typically, you know, they can't patent something that naturally occurs. They've chemically altered this and, you know, made it in a way to where I think he mentioned Pfizer and another company have now patented this as a therapy for different types of cancer and charging astronomical amounts to deliver this when it actually just comes from nature. So I thought that that was fascinating too, that, you know, I think a lot of people that maybe haven't really approached the whole holistic world of healing
Mhm.
will naturally think, well, Michelle, if this is so wonderful, why didn't my doctor tell me about it? Or, you know, why isn't my insurance covering that? And this is exactly why, right? It's originating from nature.
Mhm. And what I'll say, what I'll say about that as a pharmaceutical rep educator myself is that the doctors know what the pharmaceutical reps are coming into the office and telling them about. Okay, so their holistic training has been all optional for them. It's been elective courses. It's not part of the general training. So your doctor knows what the pharmaceutical reps are coming in and teaching them for the most part. And so that's a little scary to me. That's a scary world. That's a scary world.
I will say that's
And I know
100% true.
just
Yeah, you're right.
yeah.
And people, unless you've been a pharmaceutical rep or a healthcare provider or a nurse in that industry, that may sound like insane, but when you have so much information coming at you, you have 30 patients on your schedule for that day, they're super complicated, and somebody comes in with high blood pressure, you're not recalling Krebs cycle in your head and how these things work and what vitamin gaps there may be because you don't have a vitamin rep coming in. You
Yeah.
know, you have all of your other, you know, drug reps coming in, and that's just what you think, oh, I have that in my drug closet and let me just give it to them. And that sounds
Mhm.
crazy to people, but that's how medicine is whatever
Yes,
reps you have coming in is what you are going to start with. And it does not
exactly.
matter how much training you have in, you know, all of those gaps, and you know it. I mean, this is chemistry, this is biochemistry. That's not on the top of your mind. You know, whatever drug rep was there is on the top of your mind. You're right. There's not some astaxanthin drug rep running
Mhm.
around.
And there is, you know, the pharmaceutical reps are not medical professionals for the most part. They have a conflict of interest. They're there, they get bonus structures. The whole system needs a complete revamp, complete. And I think
Well,
it's
it
coming.
does.
People
It
are done.
does.
Yeah,
Yeah. But I think that revamp is going to come at the demand of the consumer. And as
exactly.
people like you and Dr. Rahm and myself are out there trying to educate people that you can be the boss of your body and you do have the right to make informed consent and you can have access to this information. I mean, obviously you're out there educating people. We're trying to get this information out there, but it's out there. There are good and bads of all the internet, but the information is out there and people can make medical decisions. And, you know,
Mhm.
when they have this information, then they feel empowered to make decisions on their own body. So I'm so glad you're out there doing this. I'm glad you set up that interview with Sam that we did a couple weeks ago, just to let people know that your body is dysfunctioning for a reason. And that reason is usually not a deficiency in a medicine. usually that's not the issue. And so
Yeah.
but it really does take some healing and patience and really self-confidence, because there's a
Mhm.
lot of people out there that are going to say you are crazy when you try to get to the root cause.
By the time they come to us, most of the people are just done. Like they really are searching out. So it's not like I'm doing a sales presentation by any means. They are ready. They've heard about it. Word of mouth is how we've grown. We are not a multi-level marketing. We're not out there. Sam's doing some presentations, of course, by demand. I mean, people would really they want more of him. He's amazing. But we've really grown by word of mouth. It's that coworker who was on hospice and is now back at work. Well, what happened? The doctors told me I had 3 weeks to live, and now you're back at work in a year? Like, what's going on? And it's that word of mouth that's spreading. My family members taking it, and that's the best way to grow. It really is.
I'm so
So
excited people are
we
talking
don't.
about it. Yeah.
Mhm,
I mean,
yeah.
I'm glad someone told me about it. I wish y'all were network marketing, because I would be monetizing on all this, but I'm glad to send people to you, because I know this can help. And that's how I found out about it. And then I'm like, well, I have to tell people about this. We have to let people know that there are options out there. So, Dr. Rahm, do you have any other questions for Michelle?
I do. We talked about the topical, so I just want to have people think about this. Early on in my practice, I used to see a lot of teens and with acne and adults that are having acne, probably some liver, there's a lot of detoxification stuff that can happen, but still they have this like cystic acne. And I'm just wondering, is the topical enough, and is it best to combine it maybe with, depending on your dosing, to do capsules along with the topical? So that's part one question. And then I'm also with the topical using it, like if you have like slow muscle healing, maybe like in knees or ankles or a hip, using it that way.
Those are good questions. So the first question would be, I would recommend that they use it topically and take astaxanthin by mouth. Take our product Velasta by mouth, because it's systemic inflammation, and most of the time that inflammation settling in the dermal layers, or it could be hormonal. It could be overabundance of hormones, or the hormones are not in balance. And Velasta will help with both of those issues, both inflammation and hormonal imbalances. Um, and then you could use it for faster results, is to use that topical. I think that'll give initial localized fast results, but then take it internally as well, because inflammation is really on the inside. And I try to let people know that, especially with autoimmune. Psoriasis is not just a rash that's localized. You've got inflammation in the inside if you don't take care of the internal inflammation, you're likely to get another autoimmune condition. So we've got to take care of the root cause, which is the inside. Even though you're seeing it just on the outside on one spot, you really have got some internal oxidative stress that we need to take care of. Did I answer the full question? The
And
second
then
part?
like isolate, go with the muscles, kind of the same thing
Oh,
too,
okay.
to help with repair, but to take it and put it topically as well.
So the topical will not go as deep, to try to get to maybe a deep or hip area. It won't go that deep, typically. So we'll just ask people to take that internally, take Velasta by mouth for that. But you can try it. It's certainly not going to hurt to try it, to put some salve on and on the knee area. But most of the time, it's not going to go that deep into the adipose tissues.
Okay. Sorry, I was coming back on. That was really good, because I had those same questions too, and then I had forgot to ask you them. So I think Dr. Rahm's on the same wavelength there. Michelle, if somebody has specific questions after watching all of this, they can just email. You want to give the email that they
Sure.
can send questions into?
Yeah. It's info@velasta.net, info@velasta, and Velasta is spelled V as in Victor, ALASTA.net. And
Perfect.
if they include their weight and health condition, then that's what's going to trigger us to email them back specific research for them and their serving amount with the ordering link, and also even the recommendation on the product. So if someone has got tumors or they mention something that in the email, they're going to get information on how to use the salve as well. So it's kind of like a one-stop email.
It's
And
been
then
so
they'll,
helpful. Yeah.
yeah,
The email, I mean, the response time has been great. Yeah, like you said, all the specific information, it's been a very good experience. And I've heard that from other people too. They're like, wow, they got right back to me. So
yeah. Oh, good, good. We do try to be very fast in our response time. But we also the new clients will also get a newsletter twice a week on different conditions and how astaxanthin works with different conditions. So there's a lot of education that continues on. And they also can email us throughout the whole journey, not just in the beginning, but if they have something occur or they have a question about anything that pops up, then they can email us.
I did notice that too with the last couple of orders that I got in. I got a bunch of educational material with it too, which I thought was great because that's one big platform that I'm consistently on is just once people feel educated, then they feel empowered and then they can really like be the boss of their body rather than thinking. I think what the world wants us to think is you're not smart enough to make decisions for yourself. So I like that all that education comes out because it's very easy to understand and you feel good when you feel like you're empowered to I think too, especially with cancer, but I'm sure with any condition, it can feel overwhelming and it can feel like you just want someone to tell you what to do. But when you are empowered and you understand it, it's not as scary because you know you can take responsibility and control for it and
Mhm.
then you have a solution. Michelle, is there anything else that we haven't talked about that you want to make sure that people have information about?
The only thing that I think I missed, and I would be amiss actually not to bring it back up, is how, like we talked about, how it works on a cancer cell. The glucosidic bond allows it to be absorbed by the cancer cell. That's one way it works on cancer. But if someone's got PD-L1 expressed cancer cells, PD-L1 is simply extensions off that cancer cell that allows it to hide from the immune system. It's like I call it a wall. Velasta sits on those receptor sites so they can no longer hide. So that's like another way that so now your T cells and your B cells are going to do its job more effectively in killing what's not supposed to be there. And we all make cancer cells on a day, maybe not daily basis, not sure how often, but we all have cancer cells that are formed. It's just that our body can keep up with it and neutralize them. And that's what I like to tell people is that if you're on something for prevention, then you're going to remove the oxidative stress, the free radicals as you get them. And prevention is key. So not only is this product good for someone who's got cancer, but someone who has got it in their family, or it's on the back of their mind, or they're worried about it, or everything's good right now. But prevention is really the key because you never know how good you can feel until you start feeling good. I have a lot of people who are run down, tired, stressed out, and they feel like that's just how they're going to live. That's just part of the aging process, and that's actually not true. I mean, I feel better now in my 50s than I did in my 30s. And so you can feel better, have energy, better bowel movements, clear thinking. You can help with the menopausal symptoms of that waking up at 2 or 3 in the morning and the mood swings and it can all be helped using a natural astaxanthin. And then if you use our brand, you're getting that absorption rate that is highly, highly effective. It's made to be effective to be absorbed in the intestine. So you're getting the results. Who wants to be on a product that you're only partly absorbing? You want to be on a product that is highly absorbable, and you'll feel the difference yourself. Generally, most people within that first bottle, like I said.
Which is fantastic. And I'm just so glad that we got connected because I think ultimately what you're giving people is hope. And hope is a big healer as well. And you know, there are things that you can do out there to kind of break free of the medical model, which just basically tells you destroy everything and then hope you rise back up out of it. And what I hear you saying, and what a lot of us in this space think about, is your body is highly intelligent and it is capable of healing itself. And you do have cancer in your body on a daily basis, and it takes care of it. And when that flips, when something is off, it just needs, it's just sending you a message. It just needs a little bit more help. And once you give it that,
Right.
you clean up that, things work better. And I'm sure that's why you're hearing these stories that you're hearing, is just everything is working better. And that's ultimately what we want. So, Michelle, I'm just so grateful for your time. I'm so grateful that you set this up and that you're helping us spread the word about this, and that the company is available to answer all of these questions. And, I'm just glad that we can, get the information out there and give people hope. I think we're just,
Yes.
we got to be dealers of hope. So.
Exactly. I think that's the best part. That's the best part of my role, is that I can give out that hope. True.
Yeah. Yeah,
Thank you for your
absolutely.
time.
Yes,
Oh,
thank you.
thank you so much.
And thank you, Dr. Rahm, for jumping on as well.
Yes, thank
And
you.
I'll post the link when we post this, and then the email again, just so people can have it. But thank you both for jumping on. Michelle, thank you so
Thank
much.
you.
Appreciate you.
Have a good day.
You too.